Eventually, we can do all of the operation. This isn't to say that we're replacing doctors.
Central London OSCE or London Hospital OSCE. You decide. Our Central London purpose-built NMC OSCE course and practice rooms include all of the equipment you need to practice for your NMC OSCE exam. You get the same expert team by your side, the same expertly prepared materials, and now a dedicated space built just for our international and return to practice nurses. And guess what? We've got an introductory special offer for when you book your NMC OSCE course at our website. Use company code LONDON to attend your 3-day Central London NMC OSCE course for an incredible $457.50. Learn more at www.oscenurses.com.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Gabriel. I'm a surgical care practitioner for trauma and orthopedics in one of the district general hospitals in the east of England. Practitioners are non-medical practitioners who are employed by the hospitals to work under the extended surgical team, and we work to make sure that the patient's elective pathway is as safe and as efficient as it could be. So this includes certain jobs that are traditionally done by doctors. So these are surgical interventions, consenting for certain operations, seeing patients in clinic, and managing patient pathways such as onward referral, making sure that the patients are getting the correct management at the correct time. Just now. The job involves maybe 3 or 4 types of days. The most obvious one would be helping out in theater. For example, I would normally work for acute knee injuries and lower limb arthroplasties. So that means I'm quite well versed with the operative management of patients who are undergoing, say, ACL reconstructions and total hip and total knee reconstructions. Total hip and total knee replacement. To say that we're replacing doctors, it just means that on top of what the doctors or the surgeons are doing, we are a second tier or a second check, if you will. These registrars, these surgeons trainees are, how should I say, they're trying to learn their craft. They're trying to learn to be orthopedic surgeons. So in a way, we're helping them learn because if you can imagine doing a total hip or total knee replacement, we will be doing the assisting, and the registrar and consultant will be on the other side of the table, and they will be operating. The consultant will either operate and talk through the operation, with the registrar fully concentrating on what they're doing rather than assisting and suctioning and other things like that. And also, it could be the registrar doing the operation and the consultant supervising. The main difference really of an SCP and an SFA is the amount of things and how technically skilled we are more likely to be. This would include So SFAs are in some hospitals are allowed to suture wounds. They're allowed to put local infiltration. They're allowed to retract and do multiple things that SCPs are able to do. However, SCPs, surgical care practitioners, are trained to do a little bit more than that, and in a way that we can do part, we can do most, and eventually we can do all of the operation as long as the SCP competence is agreed upon and we have vicarious liability under the hospital. The main reason why you go through the SCP course is because you want to be a surgeon and when you want to operate. And many people think that, sir, you'd be surprised. Many people think that, and to some extent, but I disagree with that. I say, oh, just because you can do it, it doesn't mean you should do it. We are not doctors, so we did not invest as much time, energy, and resources into learning anatomy and medicine. Instead of the SCP doing the operation, we have the consultants who are more experienced, who are better paid to carry the responsibility. In theory, we are trained to do most of what doctors are able to do, but with more supervision. Admittedly, I myself am not running my own list. I do run my own clinic with a consultant next door. I do various parts of the operation. For example, when we do ACL surgery, I would be able to do the graft harvesting and graft preparation. So that easily makes the operation 20 minutes quicker. Apart from the obvious positioning the patient, draping, closing the wound and things like that. And it is a really steep learning curve, and one of the most important qualities that an SCP should have, I think, is knowing your boundaries, knowing what you do not know, because it'll be a very slippery slope if you start trying to do things that aren't within your capability. And the hospital will only go as far as give you vicarious liability in the things that you are competent with. The P course would take away 2.5 years of your life. I haven't spent that much time in the library compared to the last 30 years of my life. So you have to think hard if you want to be doing this job, because academics are, let's just say, not easy. So you go through a 2-year master's course where they teach you very basic but necessary things about the job. And you will do this while you're doing a full-time job. So you're doing a full-time NHS job, and you have a part-time job doing masters. No, part-time student responsibilities as doing masters, on top of whatever else is going on with your life. So it's not that easy. We do not have an entry or exit exam. However, many of our competencies are discussed and are completed at the workplace in-house. Our clinical competencies will be judged by our consultants who we work with, as well as our managers, and whatever competencies we officially put forward. For example, if we do the non-medical prescribing course, or if we start seeing patients in clinic, or if we are allowed to order diagnostic examinations. So these things will be included in your job description. The course is hard. It takes away 2 years of your life. But if you think that it's worth it, then I'd say go for it. I mean, 2 years will fly by, regardless if you do anything worthwhile or not. So the question really is, where do you want to be 2 years from now?
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.
Subscribe to our YouTube channel. Join our Facebook group, Filipino UK Nurse. Sign up to our website, www.filipinouknurse.com.